Hi, I'm your host, Marsha Florence with Just Ask. Today's show, ladies and gentlemen, is Pilates Fitness and Physical Therapy Center. Hurry back and join us. Hi, I'm your host, Marsha Florence with Just Ask. Today, ladies and gentlemen, we're doing a special taping called What Marsha Likes, and Marsha likes Pilates. So, we're here today at Pilates Fitness and Physical Therapy Center with the owner and operator himself, Ron Jagadish. Good morning, Ron.
Good morning, Marsha.
Good to see you.
Good to see you.
Good. Now, Ron, we're doing something special because I enjoy Pilates and I wanted to share with my viewers what I think about Pilates. But first, let's start off with something about yourself and tell us about the facility.
I'm a physical therapist. I've been doing physical therapy for 25 years. I incorporated Pilates-based physical therapy for the past 10 years. So we use physical therapy by exercises using Pilates and Gyro Tonic methods of exercises.
I actually enjoyed coming here because when I had an accident a couple of years back, and when I came, I was like, okay, I hope it's just not the regular physical therapy, and sure enough, it wasn't. So you guys kind of combine a combination of regular therapy along with Pilates?
Yeah, we do. We have a traditional physical therapy and we do Pilates-based physical therapy. Here we implement more about breathing, shoulder stabilization, your posture, alignment.
Okay.
And
my posture did get better.
And your core strengthening.
And
it's all about integrating the whole body.
Okay. All right.
Instead of treating one part of your body.
Right. Now that's important because a lot of people think if they come past your facility and they say, oh, it's Pilates, I can't come in here. So that's not true.
We do have Pilates, we have physical therapy, and we have massage and Gyro Tonic.
Keyword massage. Did you hear that, ladies and gentlemen? Okay. Now, a little bit about Gyro Tonics. We had a chance to, we're going to get a chance to see what that is, but tell us about Gyro Tonics.
Gyro Tonic is a three-dimensional movement. You have more flexion, extension, rotation, side flexion, everything is incorporated. It's mostly is an energetic work. You move your body in all dimensions.
Okay. Is that upper body strength or is that entire?
It's for the entire whole body.
Okay.
It's more about the spinal articulation.
Okay. And what are some of the age criteria?
We see clients from 9 to 90. From 9 to 15, I see a lot of clients like scoliosis, adolescent scoliosis. Then we have a lot of geriatric clients who are from 80 to 90 year old. 80
to 90 year old. We're planning on taping one of your sessions, so hopefully we get to see some of your older adults working it out. And and that's impressive because our viewers, as they watch our show, are trying to find something that they can use. And I'm sure as you see me, ladies and gentlemen, I'm telling you, this is what Marsha likes. So I want to clue you in on what they do here at Pilates. And it's not just Pilates. You've got a combination of good stuff that you can do here. And then a little bit about the massages. I mean, I'm just taken by the massages. So after you have worked out pretty much, you can go and get a massage?
Yeah, sure.
See, that's what I'm talking about. Okay. Well, we're going to go to break and we're going to come back with some workout. Nice seeing you. We'll be right back.
Now, come on. All right. I know. 2 seconds. Hang on. Just stand still. Stand still, love. 1 second. I know. Just okay, good. Okay, go. Boys, hang on, boys!
You don't have to be perfect to be a perfect parent. There are thousands of children in foster care who will take you just as you are.
And welcome back, ladies and gentlemen. Now, like I said earlier, I'm interested in giving out good information about what we should be doing to maintain being healthy, nutritional-wise, physical-wise, and most definitely mental. So while we're here today at Pilates Fitness and Physical Therapy, Ron Jagadish is going to show us some things to do so that in case you're trying to do something at home, but can they do stuff at home if they don't have one of these machines?
Yeah, they can do.
Okay. Okay, so I see you got one of your instructors here, Larissa. Miss Batson is going to show us a few things. So, Ron?
The exercise I'm going to teach is mostly for the rotational sports like tennis or golf. So it a combination of side flexion and rotation. So she's going to be in a position where the leg is going to be back and the front leg is in the front. Now lift your left arm up, side bend to the right, and hold your both hands on the bar. Now take your right hand towards the corner. Now keep your shoulders square, keep your hips down. Now bend your elbows. Now you get your stretch around this area.
Oh yeah.
Relax your neck,
Okay.
lengthen your
So
back of
if
your
someone sustains an upper body accident or something, would this help in the shoulder area?
neck. It helps. It's mostly for the spinal rotation.
spine, okay.
Now from here, you can extend the spine, lift the chest up and look up towards the wall. Now curl from your tailbone and round your spine and
Wow.
bring it back. And one more
Okay.
time and lift the sternum up and up.
So Larissa, where do you feel that at?
All up and down my spine. It's a
Okay.
nice stretch.
Okay,
And
it's a good
curl.
stretch. Okay.
Now take your right hand towards your left, bring your body towards me and bring the left arm down. Now lift your right arm up and side bend to the left.
That looks like a good stretch.
Keep your hip down, feel the lengthening and reach towards that wall. And come back to the center.
So Ron, if a person, excuse me, doesn't have this device, they can still do that? in
Yeah,
particular?
they can put your both feet down on the floor or they can cross sitting. Then same thing, you lift one arm up, side bend to one side and come back to the center and lift the other arm up, side bend to the other side.
Now, would this be, excuse me, good for our couch potatoes?
Yep.
Okay, all right. All right.
Anything side bending or anything rotation from the spine, make sure that they're moving from the upper body, not from the lower back, or not twisting
Okay,
the spine.
Okay, so not twisting, oh, okay. all
Feel the
right.
lengthening before they move the body.
Okay, all right. Well, ladies and gentlemen, when we come back, guess who will be on the table? We'll be right back.
Be a fan of empowerment. Be a fan of pride. Be a fan of fun. Be a fan of Special Olympics. Make it official. Volunteer, coach, or compete. I'm a fan. Be a fan too.
And welcome back. Now, ladies and gentlemen, we're here today now with Allison Walakovich, and she is the instructor for Gyro Tonic. So Allison's going to fill us in on what is Gyro Tonics and a little bit about herself. Morning, Allison.
Good morning.
How you
Thanks.
doing?
Great. Thanks for coming.
Good, good, good.
Gyro Tonic is a movement system that focuses on moving your body in all directions. So not just forward, back, side to side. You're also spiraling and you're moving on different planes. It's great to increase flexibility, increase strength, and tone up.
Okay, now is there a particular age group that would do Gyro Tonics?
No, it's for all ages. In
Okay.
fact, they even have a little itty bitty tower for kids. So anywhere from 6 years old all the way up to
Wow.
100. It's a very gentle system, so it's easy on the joints. So it's good for an older population.
Okay. Well, since I'm in that group, okay, I figured that our viewers would like to see Marcia in motion. So give me an idea of what am I doing here?
Sure. So you're going to start with a nice long spine. That's probably the most important thing.
Okay.
This system is really about decompressing the spine. So think about elongating upwards and downwards.
Okay.
We're going to start with one arm. You're going to stretch it out, and you're just going to take it around in a circle, keeping that spine as long as you can, and then you'll bend the elbow to come in. Shoulder stays dropped. And again, you reach it out. You feel a little stretch through that arm,
Oh, yeah.
and then bring it back up. That's it. One more like that. Reaching it out.
So it's really a lot of stretching techniques.
A lot of stretching.
Okay.
Yep.
Okay.
And let's try both arms. So put both arms on, and you're going to take the arms forward, lifting your chest. So really feel that lift. And then as you come around, round your back, pull those abdominals in, and then lengthen your spine.
Wow.
Good.
Okay.
And again.
Okay. I know my viewers feel like, okay, sure, Marsha. But, you know, ladies and gentlemen, what you have to keep in mind is that stretching is important. So if you're going to start to stretch, do you have to warm up first?
This is kind of a warm-up.
Okay, this is the warm-up.
Yeah, this is a warm-up for the system. But in stretching in general, generally you do want to stretch after your exercise program.
Okay. I mean, just this part, just alone, just stretching. I know you have one that goes 2 hands,
yeah,
right?
let's do the 2 hands.
Okay.
So you're going to take that handle forward, lift your chest, really lengthen through the spine.
The chest.
And then as you come around, round your back, and you should feel a stretch through that mid and upper back.
Okay. And the shoulders should stay down.
Shoulders stay down, yep. And that's tricky for most people, to keep those shoulders relaxed.
Wow. That's a stretch.
Yeah.
I'm going to suggest to you guys, like you said, that today's segment is what Marsha likes. So obviously Marsha likes Gyro Tonics. Thank you. We'll be right back. Thanks, Helen.
Thank you.
7,000 high school students drop out every school day. That's a line of desks, more than 4 miles long. We can keep students in school. Visit boostup.org and take the first step.
All right, so you're gonna grab a hold of that front strap, and feet can be hanging off the carriage, so they don't have to be touching the floor. They can be dangling, that's fine. Arms are out in front of you like you're holding a big beach ball. This way? One strap. One strap, yes. Yep, and then bring the hands together for me, Virginia. I'm gonna come over here. Yep, just like that. Yep, got it? No, that's okay, you're good, good. Now from here, you're gonna start slightly twist it to your left. So everybody twist to your left to start just a little bit. Good. Now you're gonna twist all the way to your right. Good. And then return. Too heavy? Try that. If it's still too heavy, I can still go down some. Down some. Too easy. So it's either that one or this one. No, you were fine. Yeah. Your feet should be off the floor though. Yeah. There you go. There you go. That better? Good. How's that weight feel for you, Virginia? Is that okay? Okay. Thomas, you good?
My elbow, my shoulder's creaking, but it's okay.
Okay, I can lighten it if you need me to. All right. Good. Give me 4 more. 4. Really use that spine to twist. And 3. So remember, Virginia, not to bang up against that stopper down there. Control it back. There you go. 2 more. 2. Good. And 1. And let that rest. We'll do the other side. So walk around to the other side of your carriage. Just warming up your spine just a little bit more. So you'll need the other strap now. Yep. It's a slight, I mean, you can come all the way, but you do lose the tension in the rope. To keep the tension, maybe don't go quite so far. All right, are we good? All right, so both hands in the strap. Start slightly twisted to your right this time. Good, so twist your body to your right to start just a little bit. Take your arms with you. So you're here. Take your arms with you. There you go. Good. So twist all the way to your left. Good. And return. It's okay.
Appreciation. Pass it on. A message from the Foundation for a Better Life.
3 out of 4 kids are not as secure as they should be because their car seats are not used correctly. But the latch system makes it easier to get it right and to hold your kids tight. Anchor, tether, latch. Learn more at safercar.gov.
So push out, Marsha.
Oh, well, welcome back to the show. Now, ladies and gentlemen, we're here with Larissa Batson, and she is the manager and Pilates instructor. So she was giving me a technique right quick, but we're going to interview her. So Larissa, tell us a little bit about yourself and your role here.
Well, I am a certified Pilates instructor through Stop Pilates. I'm also the manager here, so I kind of keep things going in the office. I'm also a dancer, so when I'm not here, I'm dancing somewhere.
Okay.
So professional dancing, that is. Okay. So I actually use the Pilates method on myself as well to help me stay in shape for dancing. So it's for rehab, it's for fitness, it's for a whole array of things.
Okay, wonderful. Yes. Now, you teach the Pilates part.
Yes, I do.
Okay. So what is your age range?
My age range, I teach anywhere from 12 to 90 years old. One of the classes that I specialize in is the senior class, which we saw earlier. It was the senior reformer class. It's done on these machines here. It is a Pilates class, normally from ages 62 and older. My oldest client in that class, his name was Thomas. He's 82 years old. He's been doing it for about 2 years. So
82?
82 years old.
Pilates
Yes.
for 2 years.
Yes.
That's wonderful.
Yep.
That's really good. Okay, because now I got to show people that, see, a lot of people say, okay, well, she's not doing anything. So I need to see, let the viewers see a technique. Okay, so I was doing the swan. What is that called?
This is called the mermaid.
The mermaid. Okay, close to the swan. Okay.
So your right hand's going to stay on that foot bar there. Left arm's going to come up over your head. Now keep your shoulders square.
Okay.
You're going to press the carriage out and bend up and over to that right side over there and really reach that hand all the way over to the other side of the room, still keeping this hip down on the carriage.
Whoa.
Good. And then you'll slowly come all the way back up, sitting nice and tall. And then you do the other side. You'll put your left hand down here.
Okay.
Right arm up, and then go ahead and bend up and over to that left side, keeping those shoulders relaxed. Really reach that arm up over the head. Good breathing, nice and easy, and coming all the way up.
Okay. Our viewers would not think that Marsha is physically fit, but I truly am. Okay, I'm working on it. How's that? Now, let me ask you this. So, is Pilates more like all year round?
Yes, it is. It's because it's indoors and it's done on a machine. I mean, people can come and do it year round, winter, spring, fall, all that.
Okay. Okay. Because it seems like a lot of stuff is like related to the season, but this is not.
Not at all. We have clients that come and take it year round.
Okay, okay. And by you doing the senior group, how do you feel that the senior group gravitates to doing Pilates?
I feel like they're always a little timid at first because they think Pilates is more so for the younger population and they're not able to do what the younger people are doing. But here we really focus on getting them to come in here so that they can really keep their mobility and their strength. So it's, like I said, they're timid at first, but once they get in here and they see how they are, they're normally good to go.
Now, are there different levels in the Pilates training?
Not here per se. Because our classes are small, there's no more than 5 people to a class, we're able to cater to each different client. So we'll give an exercise, and then if it's too easy, we can make it harder for someone. If it's too hard, we can make it easier.
Wow,
So
that works for me. Okay, okay. Well, I tell you what, ladies and gentlemen, we've got to catch Larissa in action with her group. So if you don't believe me, wait till you see her group and wait till you see 82-year-old Thomas. So when we come back, we'll be checking out Larissa. We'll be right back.
good, and reverse the circle. So you'll press the arms down, open, and up. Try and keep those feet up. Good. Give me 3 and 2 and 1. Good. And let that rest for just a moment. Good. That feel okay for everyone's backs? Good. How you doing, Lorna? You're laughing, so that means only because the camera's not gonna be nice. All right. So let's take your 100 now. Let's actually do it without straps today. So go ahead and put your straps, just hook them on your shoulder rests.
Can I do it, Lorna?
Yeah, of course. Yep.
Well, ladies and gentlemen, the name of this segment is what Marsha likes. But no, not really. It's what I think you, my viewers, would enjoy. I'm enjoying watching 82-year-old Thomas work out Pilates. So imagine what you could be doing, and you're not even 82. I highly suggest and recommend, if you're homebound, unable to go out, please try something at home, whether it's in the couch, the side of the bed. Use some form of exercise at home so that it makes you feel more better each and every day. If Thomas can do it, I can do it, you can too.
exhale 2, 3, 4. 80, inhale 2, 3, 4, 5. Exhale 2, 3, 4. 90, inhale 2, 3, 4, 5. Exhale 2, 3, 4. Hold it there. Reach your right leg over your foot bar. So your right leg is going to reach. Yep. And then you're going to switch. Good. And switch. And switch. Exhale as you switch. And switch. Good. Switch. And switch. This is 4 and 3 and 2 and 1. Feet back on your foot bar. Take another rest. So should have felt lots of stomach muscles for that one. Did anyone not feel that? Are we good? Okay, let's put your feet in the straps. Did you want some more weight for feet in the straps, Lorna? Yeah. That weight feel okay for you, Virginia, still? Okay. Thomas, you still good?
So far.
Okay. All right, so legs nice and straight. Let's just lift the legs up to the ceiling, and then you'll press the legs back down. Yep, just press them back down. Yep. And you'll lift the legs up and press it down. So again, not feeling any arching in your back as you lift the legs and lower the legs. And try and keep your tailbone nice and heavy on the carriage as you lift the legs up. So Virginia, coming up just a tad too far. Feel how your tailbone is off the carriage? Right there? I want it to stay on the carriage.
I'm sure there's a lot of you at home watching this show saying, no way could I lift my legs like that. But just think, if you don't try Pilates, you may want to try a couch potato exercise, a chair exercise. So if that's what you're interested in, give us a call. Our number is 1-800-323-5336, 1-800-323-5336, and give me a show idea. If you're a physical fitness person and you have some ideas for our disabled and elderly clientele, as well as the general public, and how to better take care of yourself in health and wellness, please drop us a line at 1-800-323-5336 or email me at marsha@justastalkshow.org. Twitter, Just As Talk Show. Ladies and gentlemen, there's no way you can't get in contact with us and tell us what you're thinking about, as well as giving us some show ideas.
Good, and nice straight legs. Keep it parallel. Let's take your leg circle. So you'll bring the legs up to the ceiling, open out to the sides and circle. So the goal for this is to try and keep the legs as straight as possible, really move from those hips. So I shouldn't see any, well, for the most part, bent knees unless you have to bend them slightly. That's fine. Good. No wobbling in the pelvis. That looks nice.
Loss, it's one of the many ways to fight osteoarthritis pain. For more information on managing pain, go to fightarthritispain.org.
And welcome back to the last half of our show. Ladies and gentlemen, we have to close out with a very special part, and that is the massage. And we're here with Beth Meza. She is the massage therapist for Pilates Fitness and Physical Therapy Center. Good afternoon, Beth.
Good afternoon. How are you?
I'm fine. I had to say that with a lower tone because towards the end of the day, you need a massage.
That's right.
So tell us a little bit about yourself and your role here.
Well, I've been working here for a few years. I've been a massage therapist for about 14 years, and I do many different types of massage. I very much enjoy working here at Pilates Fitness and Physical Therapy Center because I get to see a whole range of people, types of people, and types of injuries and issues, and I have get a lot more experience dealing with different things. I have elderly people that come in and work with Ron, and then he sends them to me, and I can work whether they're having a hip issue or they're having a shoulder issue. And then there's a Groupon special going on right now, so people will come in that just are stressed and need to come and get a little relief, and a lot of those people are people who sit at the computer all day, so I have to work on their shoulders and their mid-back a lot.
Wow.
But we do focus on the full body and getting the whole body aligned.
So let me ask you this, when you're working with a senior, and sometimes people are concerned with soft tissue, so is that a problem, working with a senior with soft tissues where they don't want to be, you know, really pressed upon too hard, or what are the different techniques?
Well, mainly depends on the age, and it depends on their frailty. Most people, we work on the skin. Some older people prefer to be clothed, which works actually better for them because then the roughness on their skin is not felt.
Okay.
And it's just more of a compression and decompression types of techniques that very much help to relieve their aches and pains and help them to move more freely.
Okay, that's good. So do you have an age criteria that you work with?
All ages.
Okay, that's a good thing. That's a good thing. Because most people don't think about having a massage. But like you said, the computer world, people don't realize how intense they are when they're on the computer every day, all day, and all of a sudden now they have to be broken down.
Right.
So the shoulders go back into a line.
Right.
Okay.
That's one thing that I've really learned as being a massage therapist, that almost every profession or job has the aches and pains that come along with that. For instance, like a dentist will always be hunched in one position, and the body tries to support that position, repetitive position that dentist or hygienist is in. Their arms get very sore and tense, and they're, you know, depending on what side they tend to lean on, gets tense, and a lot of times those people will end up a little crooked as they get older, and they don't understand why.
Right. Okay. And so there's a thing called deep tissue massage and what?
There's deep tissue massage. There's Swedish massage, which is generally your basic massage. And when you work with different types of issues, you kind of have to dip into other modalities, either positional release or deep tissue, or, you know, there are different techniques.
What about expecting moms? Should they get massage?
Absolutely. That's the greatest for expecting moms, especially as they get close to delivery date. A nice prenatal massage helps to get those hormones in gear and get them set up for a nice, smooth delivery.
Okay, sounds like the place to be. So most insurances are covered?
Most insurances are covered, yeah. It depends if someone comes for physical therapy, it depends on their insurance how much massage will be included, but of course they can always add to that to give it a little bit more.
Sounds great. Okay, well, ladies and gentlemen, we'll be right back, and you know, Marsha's got it in with a bang. We'll be right back.
Everybody needs a helping hand. Take a look at your fellow man. Tell me, what can I do today?
Courtesy. Pass it on from the Foundation for a Better Life.
Well, ladies and gentlemen, we've had a long day here at Pilates Fitness and Physical Therapy Center. I'm going to close out with my massage, and remember, this is what Marsha likes. Take it away, Beth.
Have a great day.